We stand here today to declare a state of emergency in regards to the fentanyl overdose deaths for Black San Franciscans.
There has to be accountability for the people that are dealing poison on the streets. There has to be. Because you take any other category where people are dying, whether it be traffic accidents, whether it be gun violence, knife violence, domestic violence, any kind of violence. If we had hundreds and hundreds of people dying in this city, everybody would be saying, we better do something about it.
But I do agree that we cannot simply restore the war on drugs, and that's not what Chief Scott and I have tried to do. One thing that I know about the two of us is we agree that we must have solutions for those who are addicted. We must have resources. We must, as a city, as a state, invest resources in making sure that there is adequate rehabilitation services for the people who need it. We have to make sure that we not only allow them the access, but that we make it possible for them to succeed. And that's something that Supervisor Dorsey and I agree on, is we shouldn't have recovery centers where every time somebody has to walk outside to go down the street and get something that they need, they're confronted with people trying to sell them the drug that they're trying to get clean from. We have to make sure that as a city, we are taking a multifaceted approach to this issue, both from a public safety standpoint that, yes, as Director Spingola pointed out, we can't have mothers pushing strollers down the street and feeling like they have to get off the sidewalk because they don't want to walk their baby through an ongoing drug deal.
Black people in San Francisco continually are dying, and it's not a sense of urgency with anyone in the city. You know, when you talk about resources, brochures and everything, they're never culturally competent to outreach to the community that is doing the most suffering.
You know, when you hear that the numbers of the loss of life that we're seeing in San Francisco, you just realize this is something that has to be a priority for everybody. This is a public health calamity we haven't seen since the AIDS crisis, and it's disproportionately costing the lives of Black San Franciscans who have an overdose death rate 5 times that of the average. So I really appreciate the work that Felicia Jones and the Wealth and Disparities in the Black Community organization have done and are continuing to do on this. We're going to have some meetings with city leaders. We do have some opioid litigation settlement money that hopefully we'll be able to spend on programs that will save lives. So we have to do all of the above.